Welcome to the My Health Clinic YouTube channel. In this video we will discuss tips to follow a low-oxalate diet and downsides of low-oxalate food. So without time waste, let's get started. Tips to follow a low-oxalate diet. Some nutritionists advise to consume less than 100 mg of oxalate, while others recommend the dosage of 40 to 50 mg per day. Oxalate foods, in addition to oxalic acid, also contain highly nutritious substances, which have health-promoting abilities. This is the reason that you can't completely cut them out of your diet. In order to get rid of the hazards of a high-oxalate diet, you need to follow a low-oxalate diet, or moderate oxalates with healthy food. Here are some tips you can follow a low-oxalate diet. Number 1. Increase consumption of low-oxalate diet. Low-oxalate diet reduces the risk of kidney stones and helps in treatment of various range of ailments. Low-oxalate diet offers 40 mg of oxalic acid per day, and this level does not harm the body and is safe to use. It is suggested to consume this diet for 1 to 2 months to get rid of symptoms. Number 2. Reduce high-oxalate diet. Decreased consumption of a high-oxalate diet is helpful in reducing the risk of kidney stones. There is no need to completely cut the consumption of oxalate food because they contain other nutritive substances. By taking a high-calcium diet, these oxalates are excreted from the body. Number 3. Increase intake of high-calcium food. In order to reduce the risk of kidney stones, it is suggested to consume high-calcium foods, such as sardines, yogurt, cheese, kefir, and almonds. Calcium binds with oxalate before the urinary system and reduces the calculus formation. Number 4. Moderate consumption of protein. High protein intake is associated with kidney stone formation. To reduce the risk of kidney stones, it is suggested to reduce the intake of protein-rich foods, such as fish, meat, poultry, seeds, legumes, nuts, and seeds. Number 5. Drink a lot of water. Water is responsible for eliminating wastes from the body through urine. More water intake helps to excrete oxalate from the body and reduces the renal calculus formation. To reduce the risk of kidney stones, you need to keep yourself well hydrated and use 2 to 3 liters of water in a day. Number 6. Soak oxalate food before use. Soaking the oxalate foods results in lowering of oxalic acid levels. It is suggested to soak the legumes and grains to lessen the oxalates. Moreover, soaking also decreases several anti-nutrients, such as phytates, tannins, lectin, and protease inhibitors, that decrease the nutrient absorption from GIT. Number 7. Decrease salt consumption. High salt intake is associated with stone formation. The mechanism behind it is that it causes the loss of calcium and excrete through urine. When oxalate binds with calcium in the urinary tract, it gets deposited in renal epithelium and leads to kidney stone. It is recommended to decrease the salt intake to reduce the risk of renal stones. Number 8. Cooking can lower oxalate levels. Soaking and steaming the oxalate food reduce the oxalate levels. It is recommended to steam and boil the high oxalate foods, such as leafy greens and other vegetables. These foods should be boiled for 5 to 10 minutes to reduce oxalates. Number 9. Try supplements. It is recommended to use calcium citrate and calcium carbonate to people at risk of kidney stones. These calcium salts help oxalate to bind in GIT. Calcium citrate aids the kidney to excrete citrates through urine and decrease calculus risks. Downsides of low oxalate food. The main downside of low oxalate is that it restricts you from enjoying the nutritious substances. For example, spinach, a high oxalate food, is a source of fibers, vitamins, magnesium, and calcium. Beets are packed with essential nutrients, such as iron, magnesium, and potassium. Removing oxalate foods completely results in nutrient deficiencies that lead to weak immune system, retarded growth and development, anemia, and weakness. It is therefore necessary to plan your diet carefully to meet your nutritional requirement and reduce the risk of nutrient deficiencies. If you want to know more about low oxalate diet or want to read the full article, visit our website myhealthclinic.site. The link to this article is also available in the description. If you found this video is useful, then like and share the video, also subscribe to our channel and press the bell icon.